My name is Dr. William Cherniak, and I'm the co-founder and CEO of Bridge to Health Medical and Dental USA. And I'm here presenting this project on behalf of myself and my co-lead, Dr. Noreen Ahmed from MedGlobal. MedGlobal is our partner in this initiative today. I'm going to take you back to a story from February of 2019, when I was in the field with these folks here in a Bridge to Health outreach with the Kisumu County government in rural Kenya. And I was working at a clinic myself, seeing patients, when a Kenyan midwife came over to me with a mother that was in distress and active labor. And she asked if I could come over and take a look. And together we went back to the mom and learned that she was about 37 weeks gestation and had never had an ultrasound at any course during her pregnancy. So thankfully I had a probe in my pocket and popped it onto her abdomen and discovered she was having a twin pregnancy. Very quickly, the Kenyan midwife sprung into action and called an ambulance from the local government hospital. Within moments, we had the folks on the ground had collected the mother and brought her to a Kenyan tertiary care facility where she delivered a healthy twin pregnancy. So the problem here is that accessing diagnostics if you're rural and poor is next to impossible, even in the best of circumstances. But if we look at Yemen, which is facing a complex humanitarian emergency, the issue is compounded dramatically. And particularly impacted are women and children. And as you can see from the statistics on this slide, rates of maternal and under 5 mortality are particularly worrisome. And what's not shown on this slide is that out of those under 5 deaths, 18% of them are from pediatric pneumonia, which is actually a project that Bridge to Health has been working on using teleradiology. We'll talk about it now. And so the good news is that we've got a solution. As I mentioned, we've been working with point-of-care ultrasound for the last number of years, demonstrating a 600% increase in mothers attending antenatal care when we offer ultrasound by radio messaging. And our partners in this initiative, MedGlobal, have already trained half a dozen Yemeni physicians across the country. Together for this project, we're using this device here, the butterfly ultrasound, which as you can see is about the size of an electric razor, plugs into a mobile smartphone, and you can upload images through a unique cloud-based system that we're now using to monitor and evaluate and mentor trainees in the field in real time. And so what we're looking for today are folks not just to help us launch this program, but as you can hear, to actually accelerate it. And so we're looking for $150,000 a year for 2 years so that we can actually build capacity with local leadership and create a group of Yemeni healthcare workers that are not just being trained, but are actually training the next generation of trainers. We're also looking to change this from a purely philanthropic initiative into something sustainable, and then tools for IT tech. So thank you, everybody. If you'd like to reach out and learn more, please contact myself or my co-lead, Dr. Noreen Ahmed, and supporting our team of half a dozen folks in the United States and Canada, as well as another dozen or so Yemeni healthcare providers. Help us save lives in Yemen and scale this project around the world.